My name is Dr. Les Anderson, and I'm a beef extension specialist at the University of Kentucky. The focus of this short video is to demonstrate how to take a blood sample from the tail or from the jugular vein in order to get that blood sample processed for pregnancy diagnosis. One of the new technologies that's emerged in the beef industry in the last 3 or 4 years is the ability of companies to run blood analysis to determine pregnancy in beef cattle. As long as the animal is at least 30 days pregnant and about 90 days from calving, the blood sampling can be very accurate, and can exceed 95% in its accuracy. It will not give you stage of gestation, but it will give you a very accurate record or recording of whether she is or is not pregnant. The materials you will need to take a blood sample are latex gloves, a 5 cc or 3 cc syringe, an 18 gauge 1-inch needle, and of course the sampling tubes. Typically, you will get your sampling tubes and your paperwork from the company that's going to analyze your blood samples. For instance, in Bowling Green, Kentucky, Gold Standard Labs analyzes blood samples for pregnancy for beef cattle producers. If you call that company, they will send you the paperwork, they will send you the blood tubes, and if you need, they will send you the needles and syringes to take the samples. Typically, within a week of sending your blood samples, you will get that analysis back, and again, it's about 95% accurate. The first step in obtaining a tail blood sample is to put the needle on the syringe. Second, you'll get your paper towels, restrain your animal, and we'll get in behind the animal to take the blood sample. First, you take the paper towel and you'll clean the underside of the tail. Get it as clean as you can, and you'll take the tail and you'll bend it straight up. If you look at the anatomy of the underside of the tail head, you will see a groove that runs right in the middle, okay, and you can actually feel bone on both sides. Your goal with the tail sample is to go directly into that groove and perpendicular to the tail. About 3 milliliters is what's necessary to obtain a good sample for pregnancy determination. A couple of the keys, okay, to quick and accurate blood sampling. Number one, on that tail head, there's the groove. The needle must be perpendicular, not angled up, not angled down, not angled side to side, so that you can quickly penetrate the blood vessel, the vein that runs in that groove, and that you can draw the sample. Also, please use a new needle and new syringe for every sample. This prevents disease spreading. This also prevents contamination from one sample to the next. Once you've taken the sample, you'll take your tube that the sample will be sent to the company. You'll insert the needle, and the vacuum from the tube will evacuate the blood from the syringe. Make sure that the tube is accurately labeled with the sample number. So if this was the first animal that we did, it was sample number 1. With the cow's identification, this cow is Z24. So we will write sample 1, cow Z24. And then this is from the UK Research Center. So I would put some indication there that it's UK Animal Research Center, UKARC, something like that, so that the blood sampling company can accurately track which farm, which sample, and which cow. Another area of the animal's body that a blood sample can be obtained for pregnancy diagnosis is the jugular vein. We've just demonstrated how to obtain a blood sample through the tailhead. Now we're going to demonstrate how to obtain a jugular vein sample. First, the animal needs to be restrained with its head one direction or the other. I've chosen to tie her off to her left. Next, you'll want to identify the jugular furrow, and there's muscle here, and the trachea and some muscle here, and so there's a depression in between those two areas. Take your hands and just push in that area, and you will be able to see the jugular vein pop up. Okay, and it happens, it's right there. Take your syringe and your needle. Pop through, draw back. All right. And pull your sample. Typically, the best sample is taken when, again, the needle is inserted perpendicular and directly on top of the jugular vein. You can see the jugular vein right here. My thumb is on top of it. I don't know if you can see it rise and fall as I clamp it off there. But again, you want to go perpendicular and pop it right through, draw back, draw your sample, and off we go. After that, taking the sample, when you get all of them completed, typically the companies will provide you bubble wrap, they'll provide you a box, and you'll wrap the samples, put them in the box, and you will mail them to the company that day. If you're collecting on a Friday or on the weekend and you can't mail until Monday, collect the samples, keep them on ice or in the refrigerator until you can mail them Monday morning. Mail them overnight so that they can get there the next day. The blood samples will be analyzed, and again, the results are typically back within a week. Most of the time, I've been able to get them back within 2 or 3 days. For more information on blood sampling to obtain pregnancy diagnosis information, contact your local extension agent for agriculture or go to www.ca.uky.edu and look for the links to the extension publications for that information.